Hi everybody, I'm here with my dear friend and POS instructor, Dr. Shockley Wier. He's here teaching Seminar 1, came all the way from Ohio to teach Seminar 1. We had a great weekend and I figured this was a perfect time to ask him some questions. Shock has put together a new lecture for the company together with Dr. Charlie Kawaji from Australia, and it's a lecture on advanced mechanics. So let's ask him a few questions and see where did he get these ideas. Shock, how are you doing, man?
Fantastic. Nice to see you again.
Nice to see you. We had a great weekend together this time.
Absolutely.
Class went fantastic. Thank you.
Thank you very much. It was my pleasure.
So you are lecturing almost every other weekend.
Yes.
And you deal with a lot of students. You help them not only with diagnosis, but to get through their cases. Whether they have problems or the case is working smoothly, they always rely on you for help and guidance. So tell me, what made you think about putting this mechanics class together?
Well, like you said, I do a lot of case diagnosis, and I do see many progress cases every day. I see where students feel confident, and I see where students struggle. In the basic series, we really work hard to teach you mechanics. Sometimes there's such a huge volume of information, students think that some of the material is hard for them to retain all that information. So what we're trying to do is, for those students that are involved in mechanics right now, is give them a systematic approach to address things that they see in their daily practice. How to fix class 2, how to fix class 3, how to work with vertical whenever the bite opens and things of that nature. It's a good overall review, and there are new additional things that we've put in there to try to help students make their clinical orthodontics more efficient and to get increasingly predictable results.
Yeah, actually, yeah. You know, after sitting in class 8 hours straight, 4 days on a weekend, by the time you're done, your brain is pretty fried. So
exactly.
a lot of the concepts that we teach them, even though we review them often during the seminars, they kind of like escape their mind, and when they're faced with the mechanic situation in the clinic, even though they saw it, they don't remember it. So this will be a great way to go back and refresh all the concepts on mechanics. So tell me, how hard or how fun or how difficult has it been, or how easy has it been to put the lecture together? People don't know how much effort it takes. I love to hear it from you. How's it gone?
It's a lot of work. You know, we try, whenever you have cases, it takes a long time for the case to be documented from beginning to end. We want to show cases that are current. We have a lot of cases that are treated in the United States, which are similar to a lot of the cases that are treated in Europe and Australia, as well as all over the world. I've been fortunate enough to teach all over the world, so we're trying to show those cases that are applicable to everyday practice. Something I'd like to add to what you were talking about, which I find is one of the biggest difficulties that students have as they gain experience, is to feel confident whenever they look at their patient to know what to do at the next step.
That was my next question. So
great minds think alike.
Exactly.
So what we're going to try to do is give you some tips and some pointers as to how to evaluate a case at each appointment, how to feel more comfortable in your decision as to what the next step should be, and to try to take some of the mystery out of evaluation and treatment of the case on the spot. Because occasionally cases don't go quite the way you expect them to. It could be due to skeletal resistance issues, it could be due to compliance issues, and that's a lot of what orthodontic practice is looking at the case and knowing what tools you have to accomplish the tooth movements that you need so that you can increase your efficiency. I teach a lot of students that in the beginning, you're going to have a very good education. You're going to have a very solid education, and you're going to know what to do. But over time, you want to increase your efficiency. It makes for happier patients because they get treated more quickly. It makes for happier doctors because it takes some of the stress out of the situation. And at the same time, it becomes more profitable because the less times that you have to see a patient in the chair, the more money you make.
Chuck, I know I pulled you away from class. Actually, I'm sorry I shortened your lunch. I know, got you, instead of going to the restaurant, got you through the drive-thru at McDonald's. Thank you for making the time. And I know you have to go back, so let me ask you one last question. Give us a tip to all of us. What can we do tomorrow to be able to be more efficient at our mechanics?
Well, I would like you to focus on decreasing patient compliance, because whenever you rely on patient compliance, you are setting yourself up to be occasionally disappointed.
Yep.
I prefer that anytime you have spaces, to do everything you can to close the spaces with closing coils, because that doesn't require any patient compliance at all. Once the spaces are closed, if you've achieved an ideal occlusion, then you're done. If you do have some remaining occlusion to adjust, then at that point the patient can use elastics and finish settling the occlusion to get it in the proper position, but at least you kept patient compliance to a minimum, therefore increasing your efficiency.
Perfect, great tip. Indeed.
Thank you.
Compliance is one of the problems we have.
Absolutely.
Thank you, Shock. Send you back to class.
My pleasure.
So good to see you. We'll see you
Beautiful, my
again soon
friend.
here for Seminar 2.
Thank you very much.
Thank you.
Thank you.
Thank you all.